I think the most important thing that palliative care does is provide comfort. It ensures the family member that their loved one, who is at the end of their life, isn't suffering either physically or emotionally. It allows the family to interact with one another and make them feel a sense of comfort and contentment. That is the beauty of palliative care.
Eastern Ontario, the region we live in, is extraordinary. It has a vibrant economy, an enviable quality of life, some of the strongest social programs, and some of the best medical care. But there's an issue when it comes to palliative care. There's a serious gap in facilities, trained staff, equipment, and public education. And when families are faced with arranging for palliative care, the resources simply are not there to help them navigate this very difficult stage of life.
We're lucky that in my family's case we had hospice at Maycourt available to care for my sister because she was too well to be in a hospital, she was too sick to go to a long-term care home, and we couldn't care for her anymore. I don't know what we would have done if hospice at Maycourt hadn't opened their arms and welcomed her. The first week Runmoy arrived at Maycourt, she texted me. She had had her first bath in 2 years. And Linda, who gave her the bath, not only bathed her with gentleness and love, but she then put my sister in a wheelchair, wheeled her outside in the beautiful backyard, took off my sister's shoes, and helped her put her feet on the grass so that she could feel that. And that moment, my sister texted me to say she was elated and just felt so blessed to be where she was.
We are the OutCare Foundation, a small, highly efficient, charitable foundation championing the local needs of palliative care across Eastern Ontario. We are your partner to support palliative care.
The OutCare Foundation does very simple things and then much more complex things. For example, we provided telemedicine in all of the hospices in Eastern Ontario. That allows the interaction between patients and their physicians and their family members in their community. But then we also provide something as simple as stethoscopes to the Mission Hospice, or bed lifts at the Renfrew Hospice, or pressure mattresses to avoid bed sores at the Cornwall Hospice.
The donated funds that we've received from the OutCare Foundation have really helped us to purchase things that make it possible for us to offer the services so that our clients, who are people who've been diagnosed with a palliative illness, can come to a place that feels more like home, is relaxed, and they have a day away. We've also received funding which helps support care in our residential hospice, for example, equipment that makes it easier for the nurses who are caring for people in a room, to the call bell system, for example, to be able to respond quickly, and it's upgraded and more modern than what we had.
We cannot know for sure what we will need at the end of life. Ensuring the availability of the very best palliative care in Eastern Ontario simply makes sense, and it might be one of the most important things we do for ourselves and our families. You can help. Make your donation today. And for more information, please visit outcarefoundation.org.